I'm here with Dr. Clyde Yancey, former AHA president. Dr. Yancey, there were two large randomized controlled trials presented at this meeting on home telemonitoring as a tool for management of heart failure. One, a more than 1,600-page NHLBI-sponsored study, another a large German study. What is your take on them?
You know, I think these studies were incredibly important because we really needed some evidence to help us understand the enthusiasm that already exists for telemonitoring. And the evidence tells us that we should pause and think very carefully about this, because in carefully done randomized controlled trials where the standard of care meets the quality standards for heart failure, there's no demonstrable benefit on mortality or on a reduction in rehospitalizations. That's important because there already are commercial applications for telemonitoring and heart failure that are purported to improve rehospitalizations. A phone call is not all that it takes. It has to be a quality-focused approach, part of a disease management paradigm. It's not to say there's absolutely no role for telemonitoring, but it has to be part of a bigger picture. If anyone believes that telemonitoring by itself will change the natural history of heart failure, we have definitive evidence, despite all the meta-analyses and small trials and observational experiences, but we have definitive evidence that we must respect. That is not the case. Telemonitoring and heart failure alone does not improve mortality or rehospitalization. It has to be a quality-driven approach. It has to be part of a comprehensive disease management program.
So telemonitoring is not going to find its way into the heart failure guidelines at this time?
What will find its way into the heart failure guidelines is a comprehensive disease management approach. Different iterations of that are permissible, but the idea that something as straightforward as a telephone algorithm will have primacy in the guidelines referable to the management of heart failure is not an expectation at this point.
Thanks very much. This is Bruce Jansen for the Global Medical News Network.